अविनाश कुमार,
Yes, sir.
बनुशाली दीपक, ओके, भूटान नीति,
Yes, sir.
इरा, फारूकी, फारूकी शबीना है ना, गुंजन, हरिकिशन, ओके, जितेंद्र राजपूत, जोशी, कीर्ति, कार्तिक सूद, कीर्ति अग्रवाल, सभी सबका नाम आपको क्या था? फर्स्ट हम के से था।
So whole purpose of today will be, first part will be like allergy testing, how you are going to do it and how it has to be interpreted, and plus a bit we will discuss about the immunotherapy also. We have the topic also on the immunotherapy today, sublingual immunotherapy, and then skit also. So the people will be coming from outside, and those who are practicing slit, basically, I think they will be in a better position to tell you about the slit. So we have arranged that. So where's your staff? So this is a pink file which we generally use. So if you see, if you go through this pink file, you will find basically how to take history, and especially allergic history also is there. So you will be able to know, you can modify it also. Now if you see all the papers which are there, okay, I was just telling you, this is the fine pink file where now it's okay?
Yeah.
Pink file is there in which you can go through this, and this is how to take the history and everything, and how detailed you can take the history and so on. Then after that, there is consent form is there. So the consent form research also, so we have taken 68, which is going on. In this, it has been divided into 3-4 parts. The pollens are there. So the grass pollen, then the wheat pollen, and then the tree pollen, and then the dust, which includes house dust mite also, then the fungus, then the insects, and then of course the pets and so on. So all these start with this also, there is no problem. But as you go on, you should delete some of the allergens, unnecessarily why to do the test and so on. So you can delete it. And then come out with maybe 30, 40, maybe 20, it depends upon you people. So in this, if you see again, in the detail on the first page, everything is written here. Name, age, sex, where you are going to do, what is the concentration of the allergen. So all these things are written out there. And then after that, how to read the allergy testing is also written here, how to read it, like results, calculate the mean diameter as capital D by small d by divided 2, and all those things are, so you can accordingly put it, and whatever changes you want to do, you can. Okay? So on the last page, the reference has been also written, of that 4 papers, the reference has been also written. Okay? Then after that, this is for the food allergy, so that is for the aero allergy, this is for the food allergy. Food allergy also, I think it's around 67 or so has been given, but you can identify which are the foods to be kept, you can do it and so on. Then the other paper, go to the next paper, so next paper will be, I think, for the fungus. So if you want to do especially for the fungus, maybe for the AVPA or especially for the fungus. So next two pages are for the fungus. So whatever you want to do for the fungus. After the fungus, then you will find, after you have done the allergy testing and then you have found out what is positive and what is negative, and when you have come to the conclusion that these are positive and these are correlating with the history of the patient, so these are the clinically relevant allergens, then you have decided to for the avoidance or for the immunotherapy. So when you ask the patient, okay, I want to go for the immunotherapy, then you need to give an order to the manufacturer that I need a vial containing this allergen. So this is a that order form. Okay, next one is that order form. So in this, suppose you want to give house dust mite, single allergen need to be given, then you tell, okay, I want on an average, I'll slightly now start touching the immunotherapy also. Yeah? So that you have a basic, then you immunotherapy, then we will discuss in the afternoon, they will discuss it also, so it will be better for you. So this paper is about the prescription for the immunotherapy. Now we have already done the test. You have got the positivity, that may be sensitization. Now you have correlated with the history of the patient, and suppose a patient has a history of rhinitis that is perennial, and that also more in the morning or the night time, and that more at the indoor. Okay? So this looks like if the allergens may be a allergen which is perennial in nature and plus available at the home, indoor. So those are house dust mite, all the insects, okay. If the pets are there, then the pets. So these are the three types of the allergen that may be probable, maybe these allergens. So now I have done the test, and the test comes house dust mite maybe 10 into 10 is equal to 10 mm wheel is there. So and your buffer saline is 0. So this looks like positive, okay? So more than 3 mm, I have already told you that more than 3 mm is positive. So if you think in that way, this is more than 3 mm, it is positive. And if you now come with the grading system, so it looks like it's a 3 plus. Huh? 3 plus? So it looks like 3 plus. So now I have a two choice for this. One is avoidance. So I will tell my patient that okay, the avoidance has to be done. So what is the avoidance? Avoidance they are going to tell you, but I will just nurture. So no carpets at the home. Curtains should be cleaned. Mattresses, if you want to change it. Pillow and all these things should be brought into the sun at least once in a week. And everything, whatever is there, that can be also boiled and then cleaned and then put into the sunlight. So these are the basic things which you ask the patient to do it. So then the patient says, okay sir, I have already done it, so what next? Then you can advise them for the immunotherapy, okay? So practically when you have told that okay, the patient is ready for the immunotherapy, you know the single allergen is there, so immunotherapy I have to give it. So I have to tell my manufacturer from wherever diagnostic kit I have done, I am not recommending any. So you can use it, any manufacturers. So, but the manufacturer should be same for the diagnostic and for the therapeutic purpose. So now I have to give an order to the manufacturer that okay, please give me the immunotherapy vial for this patient who is allergic to a single allergen, that is house dust mite. That order I have to give it. Then the manufacturer will basically, they are not going to ask you, but the manufacturer will not understand by simple this language. So what are the things which I have to tell? I have to tell the quantity of the antigen which I want, and then I need to tell concentration of the antigen. See, the two things I have to tell to the manufacturer what concentration make. Because the test which you have done is concentration is 1:10. That's right, 1:10, na? 1:10. But we want to start the immunotherapy vial. So on an average, immunotherapy is started with the lower concentration, and then slowly the concentration need to be increased. So on an average, 90 to 95% of the cases, you need to start with 1:5,000 concentration. That's right? Okay? So, and then 1:500 and then 1:50. So this is the way basically you have to tell. So I will write to the manufacturer, okay, I need a vial which contains antigen of house dust mite of 5.5 ml, and I need one vial of 1:5,000 concentration. Because 1:5,000 will last for months, so in 1 month it will finish. So I need to give a beforehand order another 1:500 and another 1:50. So 3 vials at a time you can ask the manufacturer to give it. Okay. So this is the order form. Okay. So I will tell house dust mite, I want 1 is to 5,000, 1 is to 500, 1 is to 50. So take one this and then 5.5 ml, and then I said I tell the manufacturer to give it the vial. Okay. Now another point which I want to discuss it here only. Suppose there are two antigens which are positive. Suppose there are two antigens which are positive, means it's a correlating with the history also, and you are 100% sure this is also allergy, this is also allergy. Okay. So now your grading system will help you here. So two antigens are there. So we need to mix two antigens. I will come which are to be mixed, which are not to be mixed later on. So I don't want to make it complicated. Simple. I am trying to put everything in a simple way. So two antigens, suppose I need to mix. So then I have to give a order to the manufacturer. I want a vial of 5.5 ml which should contain this antigen this much and this antigen this much. Okay, concentration is whatever we have taught. So suppose two antigen 1 and 3 plus. So I need a concentration of both should be 5.5 ml. So can anybody tell me that then what should be the amount of this antigen and what should be the amount of this antigen?
2 should be higher. Should be higher.
You're right. So okay. So the best is basically higher the positivity, more amount of the antigen need to be there. So 2 plus and 3 plus. So you can calculate like 5 plus is equal to, so 2 plus 3 plus 5 plus is equal to 5.5 ml. Okay. Simple calculation. And then 1 plus is equal to 1.1 ml. So 2 plus is equal to 2.2 ml. And this is 3.3 ml. So I have to tell the manufacturer the antigen number 1 you give this much 2.2 ml and the second one is 3.3 ml, total mixing it is to 5 ml. That's okay? Clear? Absolutely, calculation is clear. Now the manufacturer gives me the vial basically. He has given me the vial. I will go for the single one. Okay, one vial he is containing both or containing single, that will make it. One vial the patient has, the manufacturer has given. So how to go for the immunotherapy? So this is the chart which is there for the immunotherapy. Okay. So one vial of the concentration, 1 is to 5,000 he has given, 1 is to 500 and 1 is to 50. Now the basic concept of the immunotherapy is,
Sir, this vial is for subcutaneous immunity.
I am talking about subcutaneous. So I am not taking any class for the sublingual or the tablets. That is going to be taken by the people who are using it practically. We are not using it. We know the things, but I want that they should tell you because they are using it. Okay. So that's okay. So till now, okay. So now the vial has been given to me. One vial the person has given. So I will start with the lowest concentration. So what is the theory behind the desensitization? It can vary from place to place, but the basic principle and the theory is same. Slowly you should increase the concentration of the antigen. Slowly you should increase the amount of the antigen, and slowly you should increase the gap between two doses. Okay, so that you come to a build-up phase and then after that maintenance phase. Ideally the maintenance phase should be concentration 1:50, amount 1 ml, and the duration between two antigen, the distance between two antigen 1 month. So that should be the ideal. You may reach, you may not reach. And then after that you maintenance phase. So build-up phase you start with 1:5,000, then proceed to 1:500 and 1:50, and slowly you increase the quantity of the antigen, and slowly you increase the duration between two antigen. That is the basic principle. Some variation may be there, from place to place, but we are for around since 75, 74, we are following this and we are comfortable and we are getting the good result. This variation may be there. So it is written that 1 is to 5,000 concentration. It's written 1 to
Yes, sir, yes.
sorry, 1 is to 5,000 concentration. Give 2 injection in a week, okay? And this is the amount which is written. So 0.1 ml, 0.2, 0.3, 0.4, 0.5, 0.6, 0.7, 0.8, 0.9. As soon as you reach 2.5, then 0.6 has to be divided into 2 places. It has been seen that if you inject more than 0.5 ml, the absorption is less. So that's why after 0.5 ml, you should divide the antigen into 2 parts and you give it at 2 places, 2 sites. So suppose it is 0.6 you have to give, so you can give from the same series 0.3, 0.3, 4, 3, 4, 4, 4, 5. So anywhere it is not going beyond 0.5. Okay? So then after that you should increase the concentration, that is 1 is to 500, same way we have to give, and then you increase to 1 is to 50. So same way we have to increase it, and now the maximum concentration is 1 is to 50. So you reach it, then you start increasing the dose. So after that 0.5 ml is given, and it is maybe it is once in a week and so on. So after that you maintain 1 is to 50, then you increase the dose 0.6, 0.6, 0.6, 0.6, and then you increase the duration once in a 15 days, then once in 3 weeks, and then once in 4 weeks, so that you reach to 1 is to 50, 1 ml, 1 is to 1 ml and 1 month duration. So that is which when you reach there, that is the maximum build-up dose, and then your maintenance dose starts, and then you can continue for 3 to 5 years. Okay? But you can reach to the maximum build-up dose before also. Suppose you have reached 1 is to 50, 0.6 you are giving, and as soon as you give 0.7, there is some reaction, there is systemic reaction, everything, so the body, that the maximum build-up phase is this only. So your maintenance dose is this only, and then you can continue, you should not go to 0.7, 0.6 is your build-up maximum capacity, and then you continue. So your amount has been now fixed 0.6, only the duration need to increase so that it comes to 1 month, and that becomes your maintenance dose, and you continue for 3 to 5 years. Okay? So these are the charts which is given here. I have already told you, charts is given here. And then follow up, nothing has to be done. In the follow up, basically there is no need of doing any parameters, any blood investigation, only the medication requirement, whether it has decreased or not, and your symptoms have decreased or not. Okay? So this basic immunotherapy I am trying to give it to you. Whenever you start the immunotherapy, then if you give the first injection and the results starts coming after 3 to 6 months basically. Some people say 3 months, 6 months. So 3-4 months it will take. So as soon as you start the immunotherapy, you tell the patient basically mechanism they are going to tell you. So that you tell the people that there may be increase of the symptoms, because initially there is an increase of the IgE level, and that starts declining after 3 months. So initial 3 months there may be increase of the symptoms, so you can tell them, otherwise they will tell that you have started the immunotherapy injection and there is an increase of the symptoms. So that need to be told. If anybody says, I have taken the first dose and second dose and I am feeling much better after that dose only, scientifically it does not work like this. This may be just a psychological effect. Pharmacotherapy need to be continued basically, and step down as immunotherapy takes care, the symptoms will decrease, and then you need to step down the treatment, which is there in area guidelines also, in the GINA guidelines also. So step down treatment you need to do it. So that much basically I just wanted to give you that background so that you have a background of this, and then when you sit down today, then you will be able to understand. Okay, so whole chart I have made you understand how it has to be. Now practically what we are going to do today, we are going to demonstrate how the allergy test to be done basically.
Sir, one question. So, suppose while introducing the patient with the SCIT, while
Immunotherapy will not discuss anything. After you complete the main objective right now, then again we'll sit down.
Okay,
We'll sit down
okay,
here.
okay.
We'll sit down. So I just give you background because these are the charts which is there. So let us go step by step. You will be able to know everything, whatever is there in my mind. Will not leave, don't worry. But now otherwise time will be short.
Okay.
भी ऐसा करना पड़ेगा, हमें आज का यहीं पे करना पड़ेगा. Let third day be all comes divide into 3 groups. समझ रहे हो? हाँ. वो टाइम नहीं होगा. अभी 12 बज जाएगा, करते करते 1 बज ही जाएगा.
रोटेशन वाला थर्ड डे करेंगे.
थर्ड डे करें.
ठीक है सर.
ठीक है?
ठीक है.
So let it be till 1 o'clock.
ओके.
So what if the patient misses a dose?
Pardon?
What if one dose is missed by the patient?
We'll all the questions for the immunotherapy, we'll sit down after whatever I want to get it done. So after that we'll sit down and all the questions I will take up. Every question I will take up. So with that now we start doing the testing. The testing can be done by the prick method. I have already explained you how to do the prick method basically. We have the interdermal also facility here, we are going to do it. So what we are going to do with this background, indication, selection of the patients, everything I have done. Now I am ready with my kit. So the kit I have prepared, these are the 4-5 kit antigens. I am ready with the kit. I am ready with the emergency tray also. Where is the emergency tray? Right? Achha, so emergency tray here only, emergency tray she has written like this. Emergency tray here only, okay. But you should have, we should have a separate emergency tray, but she has put it here. So, okay. So now, what are the things which you need to have in your clinic? So you should have a needle, you should have the lancet, then you should have the antigens which you require, and then emergency tray should be there. Adrenaline hai? Adrenaline loaded, she has kept it here only. Okay. Now what you need basically, you need the swab. अच्छा ठीक है. There is a split swab you need to have. ये इसमें क्या है? So split swab has to be there, general cotton has to be there, then you need to have the scale basically, the different kind of the scales are there, then you need to have the marker, you need to have the blotting paper basically, which I told you that after giving the injection. So when you clean, you need to have the swab. Then when you start doing the test, you should have a marker first, so you have to put the names of the antigen, so antigen 1, antigen 2, antigen 3, so marker need to be there. Then after that you need to have the antigen, so antigen dropper, you have to put the antigen here, and then after that you need to have the, I am going sequence wise, so you need to have the needles or the lancets, so lancets are there. After that doing the test, you need to basically have the blotting paper, so you can, so that you can just keep it on this, so the whatever the extra antigens are there, that will be absorbed basically. Don't wipe basically like this, because otherwise cross contamination will be there. Then after that, when the patient comes to you, then you need to see the wheal formation. You should have a good light. Your patient should be comfortable. You should be also comfortable, and then after that you have to measure. So measurement I told you in the beginning only. So whatever the wheel, suppose the wheel is like this, so outer aspect of the wheel you should give the marker like this, marking like this. So you need to have the marker which I have told you. Then measurement, I have already told you how to measure. So these are the instruments basically you need to have. And then after measurement, you have done it measurement and everything, then what you can do, you can have a adhesive tape basically, where what you can do, suppose this is the wheel formation is there, this much is the wheel formation, then I can just put it here and this will be put, it will be put like this so that the everything will be there. So medico-legally also there will be no problem for you. So that's okay. So that's what instrument you need to require: emergency tray, BP instrument, stethoscope, oxygen, and your bed. So when you go to our center, you will find everything. So with that background, I have prepared myself. Patient comes, patient is comfortable, and then I will show you the demonstration now. Okay? So any volunteer, you want to become volunteer? No problem? So now we are. So if suppose I told you that these creatures should be avoided first. If there are any vessels that should be avoided, don't prick on the vessels basically. And if lot of hairs are there, that should be saved, and that should be saved at least 24 hours before, not on the same day. Okay? After that, what you need to do, you need to just you need to have like this, just like any surgery you do the cleaning. So when you start from one place, you should not touch again that place. So cleaning can be done. Okay? And then you should have a dustbin, you can discard it. If you want to do it again, you can put it again also, there is no problem in doing it. So again you start with the middle, and then after that you go to the periphery. Same way you start with this place and go to the periphery, and then after that you discard it. So this is the cleaning. Wait for some time, let it dry. After this, the patient is comfortable, I am also comfortable. I am going to mark maybe A1, K2, buffer saline, control. So this way I am going to mark it, and then after that I have the antigen. Once I have here one, antigen 1. So then I need to put a drop of the antigen here. So I put a drop of the antigen here. Okay. Care should be taken that stellate should not touch the skin. Otherwise, if there is any infection is there, so unnecessary this will touch, and then ultimately this will. So only the drop should touch basically. The drop should touch the skin. That's all basically. So this is again this, and then you have to touch. Yeah, this is that. Okay. So then after that this, and this is again. This should touch this. This buffer saline. Okay, and this is your histamine. And this is your histamine. Okay, so from this I have put it everything, and then I can use either lancet or your needle also. It's better to use lancet than the needle, but for the practical purpose I just wanted to show you. So the ergonomics, this stellate should be up, and then you need to prick, take a help with the little finger like this, there is no problem, and then from here, don't worry, no pain will be there. So I have to just prick it like this. If I go in the slow motion, I need to just do it like this. Okay? So that there is a aberration, there is a gap between the skin, so that the antigen goes inside. Okay? No pain, no?
Divide should be upward.
Bevel should be upward. Okay, so I just put it slowly like this. Fast like this. Okay? So this is, with this, one needle or one lancet for one antigen. Then if I want to do with the lancet, then same way basically I can do through the lancet, just put it here, prick it. Prick it. Or if I want to do the puncture, I can just do it puncture. So this is the way basically. That's okay? So again I will throw this. Again I will demonstrate with the lancet. So with the lancet, Again, 45 degree, like this. Okay. Here also, sorry. Here they also 45 degree, and then I just prick it. Just prick it.
It's 1 mm.
Just prick. Yeah. And then if I want to put it like this, put it like this. That's all. So in this way I can do with this, or with the needle. Again I will show you the needle. Is bevel up. I have to just slow motion. I am doing it like this, or fast prick it. No puncture with this. Okay. So this is the way basically I need to do, and then after that, what I need to do, I can just put the blotting paper, so that whatever the extra antigen is there, so that will blot it automatically. So I can keep it like this for some time, or I can just put it like this, and then I can take it, and then wait for 15 to 20 minutes for the reading of the reading. I have already told you, which we will do it right now. Okay, so this is the way basically you need to do. Okay, so another half an hour, what we will do, we will choose the pairs. Each person will do on themselves basically all these 4 integers, nothing to worry. There was no pain, na? ऐसा कुछ तो problem तो नहीं हुआ? So whoever is sitting on the front row, keep sitting. Whoever is the second row, they should go to the other row, comfortably make the pairs. Everything is same, everything is there, our people will be there, and they will explain you. After you do the test and everything, then come back again, then we'll reading, everything will be done, and then we'll discuss about the immunity. So all the questions which are there in your mind, that's okay? So ये चाहिए आपको?
आप इधर आ जाओ।
आप सबको समझा दीजिए। But I want everyone to do it. Yeah. No exception. Everyone has to do it. ठीक है, तो आप देखो इधर।
दो कंफर्टेबल, ये हाथ रखो ना, ये रखो से अच्छा है ना, एकदम कंफर्टेबली रखो, हाथ कंफर्टेबली रखो। फिर 2 से 3 सेंटीमीटर के बीच में मार्क करो, एक हिस्टामिन, एक बफर सलाइन, 2 रुक जाओ, अभी थोड़ा सूखने दो, थोड़ा सा सूखने दो। कंफर्टेबल, एकदम कंफर्टेबल, करने वाला भी कंफर्टेबल होना चाहिए, जिसके पास कर रहे हो वो आराम से जैसे कर सकते हो। आप अपना हाथ ऐसे नहीं रखो ना, टेबल पे रखो, टेबल पे कंफर्टेबल। तो आपने गलत हाथ चूज किया ना, मैंने इसी उन दोनों का वो कर दिया। आप मैडम का इस वाले हेल्प पे करना। ठीक है, हाँ ठीक है, गुड। अब आप ये एक ड्रॉप रखो, एक ड्रॉप। हाँ बिल्कुल, बस ठीक है, एक ड्रॉप आने चाहिए। ओपन आया है, उसको खिलाओ, नहीं नहीं इतना नहीं जाता है यार, फिर लेंसेट करना है, दोनों
सर इसको
इसमें नहीं, फिर ये करने को मौका नहीं मिलेगा ना।
लगा नहीं
मिडिल में किया, ठीक है।
कंट्रोल में तो आना ही चाहिए ना बाकी
कंट्रोल में तो आना चाहिए।
दबा दो बस है ना। तो पंक्चर जो है ये
वेसल
यार कुछ नहीं होता, ये दोनों में तुम्हें इस पे दिखाऊंगा ना पहले ये डॉप 26 किया ये बस हो गया। अब आप कर रहे हो ठीक गुड 45 मिनट 15 मिनट पे देख के रखना 15 मिनट पे रिजल्ट। अब ये दोनों नहीं अच्छा अब आप इनको कर रहे हो ना दोनों ब्रेक हो गया वो अब ब्लड कर दो ब्लड करके 15 मिनट वेट करो 15 मिनट पे हम रीडिंग बताएंगे क्या जी कोई बात नहीं दूसरा ले लो भाई
मैम
नहीं मैं अभी दे रहा हूँ मतलब you don't die until and unless you have an institute unless and unless you have take the consent and tell them this is only the research you may benefit may not benefit we are giving one or two only those who have anaphylactic reactions or those who are if you wanna we will try on trial basis and the all injection will be given here not allowed to give anywhere अभी मेरे पास एक बच्ची है उसको मैं चला रहा हूँ these are till now only research in trial few trials case series show there is improvement now sir lecture लेंगे the recent guidelines is oral immunotherapy for make a peanut are recommended oral immunotherapy not sublingual not subcutaneous so there is a big separate whether that immunotherapy will benefit I am not sure about that but one proven case of Dr. Rajkumar there are a number of cases from other countries also and we are now giving for one एलो एलर्जी दिक्कत है अस्थमा है एलर्जिक राइनाइटिस है ओनली फूड एलर्जी ना डरो नहीं कुछ होगा मैं आई कुछ नहीं होगा उसको कुछ होगा मैं अटेंड ठीक है ये एलर्जन दोनों क्या है नहीं इतना डर रहे तो तुम कंट्रोल दोनों करो अपने फील के लिए एलर्जन दोनों करो नहीं कंट्रोल से तो कुछ नहीं होगा ना सलाइन और हिस्टामिन का तुझे भी तो थोड़ा सीखना है ना करो कुछ नहीं होगा कंट्रोल दोनों कर रहे इतना डर रहा है यार मैं कंसेंट दे रहा हूँ ये कंसेंट दे रही है तुम्हें क्या टेंशन हाँ एलर्जन दोनों नहीं करो ये पता हिस्टामिन को डॉक्टर सी पे डालो हाँ बस तुम्हारा फीलिंग के लिए कर रहा है ना बाकी कोई पॉजिटिव नेगेटिव था अपने रिकॉलेशन आप प्रॉपर एलर्जन दोनों नहीं करो हो गया फिर क्यों इतना डर रहा है हिस्टामिन तो कुछ नहीं होगा Earlier it was the only double-blind control test. Now for few there is the skin prick test is considered. For few allergen IgE also considered. But the this result this positivity of this limit is different for different allergen. फूड को इतना मिक्स नहीं करो फूड बहुत ही मुश्किल का एक वो है इसको इधर रखो इधर थोड़ा आगे रखो ताकि तुम्हें आराम आ जाए उसको आगे कर दो ना हाँ अब अच्छा आएगा ना लास्ट 2 वीक बैक में भी हमने किया था वहाँ से भी एक डॉक्टर साहब को था शी इज कमिंग बैक टू दिस टेस्टिंग शी हैज आल्सो मशरूम एंड वो भी करना और हम फूड एलर्जी जैसे आप अगर प्रॉन्स का वी विल डू extremely low concentration. This is 1:10. We starting with 1:5 lengths. आपको इतना करें इस तरह से no, that's why we diluted the concentration to 1:5 lengths with the brick test. If comes positive, we stop there or we go for a one test mode. If not comes positive, we go for 1:5,000. If comes negative, we go for 1:500. If comes negative, 1:100. ऐसे करके ये आने चाहिए. Otherwise, इससे डायरेक्टली करते हैं इस कंसल्टेशन. वो है ना? This is highly not recommended at all.
बट वो अगर करेंगे भी
तो अगर आप प्रैक्टिस कर लो तो तब तो गलत हो सकता है, वो उससे दो एलर्जी और बढ़ जाए तो आप उसको क्या आंसर करोगे. देखिए and then the guideline is also not recommended here, but studies have proven that more than 60-70% the sensitization is decreasing, but not recommended to do for follow-up. Follow-up करोगे तो टोटल IgG नहीं करना है, स्किन प्रिक टेस्ट नहीं करना है. अरे वो कम ही नहीं होगा, हो सकता है कम हो, कम नहीं होगा तो तुम उसको क्या बोलोगे. तो बोलना है ना भाई, ये रिकमेंडेड है. किसी सोसाइटी ने ऐसा रिकमेंडेड नहीं किया. व्हाई आई एम ओनली इफ हियर गुड इनफ बट इट इज नथिंग टू डू विद योर ट्रीटमेंट. नहीं तो तुम्हारी ट्रीटमेंट हम पर हो जाएगा. तो नहीं मानेगा तो नहीं मानता. मेरे पास 100 पैसे हैं, मैं एक नहीं मानता है. Starting only you have to explain each and everything. I am doing 4 to 5 every day, but I am doing 5 उससे ज्यादा नहीं छोटा सा भी चिप करने वाला है. I will not give to immunotherapy. जब तक मेरे गाइडलाइन में मेरे उसमें फिट नहीं हो, थोड़ा भी उसके दिमाग में शक होगा कि सर इससे मेरे को कुछ फायदा नहीं. It is one of the treatment option. That is to be able. ये नहीं कि तुम ये करोगे तो बाकी सब कुछ minimum is the allergen, better is the result. Single is the allergen, better is the result. ठीक है. मिक्सिंग का दो हमको यही चीज पढ़ाते हैं ना. ग्लूकेन कहता है बिल्कुल मिक्सिंग करो, अमेरिकन कहता है हाँ मैं मिक्स कर सकता हूँ. वी बोलता है अभी तक कोई प्रूफ नहीं है. सिर्फ कंट्रोल रहा है. 2024 गाइडलाइन की सिर्फ मैं 3 का बोल रहा हूँ. मैं पीनट एग उसका ओरल और वो भी डिटेल में पढ़े तो कुछ समझ लिया है कैसे देना है. होता है कि खिलाओ छोटा छोटा करके. इतना स्टैंडर्डाइज नहीं है. ठीक है. बट यूरोपियन इज नाउ एग्री फॉर these 3. ठीक है. इवन डेंडर इज वेरी गुड. डेंडर एनिमल डेंडर जो इंडिया में नहीं होता है वैसे डेंडर इज अ गुड मीडियम एंड दे इज रिकमेंडेड इन अमंग द फंगस एलेडोस्पोरियम इज अंटाडेनम. दीस आर द 2 दुनिया भर सब क्यूटेनियस का ये तो है. अब सब लिंगुअल का पूछ रहा हूँ. सब लिंगुअल का अच्छा है, सेम है मोर और लेस उससे सब क्यूटेनियस कितना अच्छा है. बट और उसके एडवांटेज ये है कि आपको इंजेक्ट करने की जरूरत नहीं है, पेशेंट को बार-बार बुलाने की जरूरत नहीं है, लेकिन कंप्लायंस लो हो जाता है. अवेलेबिलिटी ऑफ एलर्जन बहुत लिमिटेड हो जाती है. सब लिक्विड के सारे बन नहीं सकते. और इंडिया में अभी अप्रूव अगर प्योरली आप डीजीएच अप्रूव जाएगा तो सिर्फ ऑस्ट्रास्पाइड का टैबलेट है और कुछ भी नहीं है. बाकी जो भी दे रहे हैं वो आपके जिम्मेवार पे वो प्रैक्टिस कर रहे हो. हाँ बोल ही नहीं सकते हो. स्टैंडर्डाइजेशन में वगैरह कुछ है नहीं तुम्हारे। देख हम दिल्ली वाले दो रूम से कर रहे हैं, हमें अच्छा रिजल्ट मिल रहा है। महेश सर वहाँ से कर रहा है, बैंगलोर से अच्छा रिजल्ट मिल रहा है ना। बट देयर इज नो बेस्ट था एसोसिएशन पहले मार्क का, वो अभी इंडिया से आउट हो गया। दोबारा करो तुम दो। कोई फायदा नहीं है ना, कैसे करो। इसीलिए तो बोल रहा हूँ, कंप्लेंट को अच्छा करने के लिए आपको पहले ही समझाना पड़ेगा। आपको कम से कम 3 साल, मेरे पास 30 साल का कंप्लाइंस पेशेंट है, तो 30 साल से ले रहा है। वो तो हमारे कम्युनिकेशन के स्किल पे डिपेंड करेगा। बोर्ड साहब ने शुरू किया 30 साल से, अभी मेरे पास फॉलो करता है वो पेशेंट, 2 पेशेंट। 15 साल से वो वाले मेरे पास 15-20 पेशेंट जो 15 साल से ज्यादा ले रहा है। वो बोल रहा है कि मेरे को बंद नहीं करना, बहुत अच्छा है, मेरा इनहेलर खत्म हो गया, मेरा सांस खत्म हो गया, मैं तो बंद नहीं करूंगा, आप जो करना है करो। तो आप क्या कहा, उसको क्या जवाब देगा? किसी गाइडलाइन ने नहीं लिखा है 5 साल से ज्यादा दे दो, लेकिन वो बंद ही नहीं कर रहा है, तो मैं क्या कर सकता हूँ? मिनिमल सा कुछ नहीं होगा। 3 years of allergy immunotherapy is recommended by the ALDI guideline, and after 3 there is shown that the effect is remained for next 2 years. ये प्रूफ किया है। बाकी इतना लंबा फॉलोअप स्टडीज होता नहीं। रिकरेंस का अभी तक कोई स्टडी नहीं है, अगर रिकरेंस है तो रिपीट करके दोबारा चेंज करें रिकरेंस का। लेकिन 20 साल के 14 साल के फॉलोअप में सेंसिटाइज कम होता है, ये तो देखा है। सिम्टम्स का भी है। हाँ आप 1:50 पे ना, ये 1 वीक जा रहा है। 0.1, 0.2, 0.3, 0.4 यहाँ आते, फिर 0.5 कर दीजिए, ठीक है। 0.5 के बाद फिर नेक्स्ट में आप 1 इंजेक्शन इज 2 वीक, एक ही आप 2 हफ्ते में एक ही दे दोगे, लेकिन 0.6 दोगे, 0.6 देगा तो 0.3 दे दोगे, 0.3 दे दोगे, ठीक है। नेक्स्ट 1 in 3 weeks, वो 0.7 हो गया, ठीक है। अब सपोज इधर पेशेंट को रिएक्शन करने लग गया है ना, थोड़ा ज्यादा सिम्टम, इम्यूनोथेरेपी के दिन ज्यादा ईचिंग आने लग गया या कुछ रिएक्शन हो गया, टॉलरेट नहीं करने लग गया। ऐसा भी हो सकता है नहीं टॉलरेट कर, हाँ, तो क्लिनिकल नॉट टॉलरेट होगा, तो उसका मैक्सिमम कंसल्टेशन ये है कि आपको 0.7 पे ही मेंटेनेंस होगा। ब्यूडअप आपका खत्म हो गया, आप यहाँ तक जाने की जरूरत नहीं है। आप किसी को नेक्स्ट इम्यूनोथेरेपी में 1 in 4 कर दोगे, एक ही महीने में 1 कर दोगे, देन यू विल फॉलो। ये सब पढ़ाएंगे यार, पहले अभी स्किल प्रिंट वाला पूरा करो। 3 दिन में तुम लोगों को यही चीज पढ़ाते रहेंगे, 10 बार पढ़ाएंगे। डाइल्यूशन की कोई एरिया उस पर पूरा लेक्चर है, वैसे कोई डाइल्यूशन नहीं। हमारे इंडिया में जो आता है 1:1000 का आता है, 0.3 to 0.5 ml इंटरमस्कुलर लेटरल थाई पे देना है। वैसे मैं यहाँ पे 7 साल से हूँ, मुझे कोई एनाफिलेक्सिस नहीं हुआ, बस इतना सुन। राजकुमार सर इधर 30 साल से यहाँ कोई एनाफिलेक्सिस नहीं हुआ। तो तुम ऐसे भी हम दोनों भी हो जाए, उससे क्या करना? अगर किसी को भी हो जाए तो एलर्जी रिलेटेड थोड़ी है, एलर्जी रिलेटेड तो एनाफिलेक्सिस है ना, अपने को एनाफिलेक्सिस नहीं होना चाहिए। अगर होगा भी तो वो प्रिवेंटेबल है। इम्यूनोथेरेपी से मोर्टेलिटी है, प्रिक से नहीं है। प्रिक से एनाफिलेक्सिस है। ये नहीं सोचना भी कुछ भी होता है, बंद कर दो, आंखें बंद करके सब प्रिक करने लगो। अगर रियल प्रैक्टिस करना है तो हिस्ट्री वाइज पहले 5 का 3 का 2 एलर्जन से शुरू करो, दैट इज द बेस्ट वे। ठीक है, अपने को वो नहीं, वो मीज यूज करके भाई 200 का कर देंगे, फिर खुद समझ नहीं आएगा, 25 पॉजिटिव आएगा, क्या करेगा? हाँ, अच्छा धीरे धीरे करते रहोगे ना। कल मैडम को देखना है, डॉक्टर मनोज को देखना है, ये दोनों तो 10 मिनट में 40 साल का खत्म कर देता। हम लोगों का इतना नहीं है ना, तो हम रोज नहीं करते है ना। तो जितना आपका हाथ प्रैक्टिस हो जाएगा उतना अच्छा हो जाएगा। हमारे यहाँ इन लोगों को 3 साल 25-30 साल से एक्सपीरियंस, ऐसे जितना मशीन की तरह, तो वो एक्सपीरियंस बताता है ना। और ENT वालों का आपका तो बहुत परफेक्ट है, एलर्जिक राइनाइटिस नहीं होगा, पीडियाट्रिशियन बहुत अच्छा है, बच्चे में बढ़ेगा नहीं। हमारे पास तो तुम सबका वो कॉम्प्लिकेटेड वाला अस्थमा वाला आता है ना, लेकिन हमारे मैक्सिमम मेरे पेशेंट में राइनाइटिस राइनोकंजक्टिवाइटिस in the ideal immunotherapy for rhinoconjunctivitis rather than asthma. Rhinoconjunctivitis is the best.
कैमरे वाला
जो गाइडलाइन सारे को आगे ही लिखा है एलर्जिक इम्यूनोथेरेपी पर राइनोकंजक्टिवाइटिस।
देव बोल रहा हूँ। कब तक हो जाएगा सर, किसी को देना? हाँ
अच्छा मतलब ये इधर एक और इधर कितने भी है मतलब एक लाइन में 2 ही टेस्ट ये 3 और 4 अच्छा लेकिन बफर कंट्रोल भी रखना है बफर कंट्रोल बफर कंट्रोल एक ही है
सबसे पहले करने से पहले डर्मेटोफेजम भी चेक करना है, अगर वो होगा तो कोई फायदा नहीं होगा, पेन जैसे है ना फिर सारा पॉजिटिव आएगा, ठीक है। हाँ ऐसे स्कर्ट्स करके देख लेना। एक तो कैंसर में नहीं करना है, HIV में नहीं करना है, इम्यूनोसप्रेशन सीवियर इम्यूनोकम्प्रोमाइज पेशेंट में नहीं करना है, पहले कौन इंडिकेशन सारा पता होना चाहिए, तब जाके आपको फायदा। एंटी हिस्टामिनिक ले रहा है नहीं करना है, हिस्टामिनिक सारा बुक में लिखा है ये 1 और 2 है ना। हमारे पेशेंट लोगों का इतना एजुकेटेड नहीं होता है तो बेस्ट है 7 डेज बंद करो फिर लो। आउटर को आप जिन का आ गया उसका वो करो, मल्टी करो, गोल बनाओ।
तो काम पे है बोलो।
जो पॉजिटिव है ना उसके आउटर बॉर्डर पे ऐसे मरकर के साथ देख, अब पहले फील करो ना, अगर किसी का दिख नहीं रहा है तो फील करो, जिन पे ऐसे वो ब्लैक बना हुआ है ना,
ठीक है बात
या नहीं तो इसको मोबाइल के इससे भी करो, या कभी कभी नहीं दिख रहा है तो ऐसा करो, ऐसे दिख जाता है।
हाँ कौन सा
ये भी बहुत अच्छा है। मिलीमीटर के स्केल से नापना है। बफर से कुछ आएगा नहीं, तुमको क्या पता करना है बहुत अच्छा है, ये बहुत अच्छा है। हाँ इतना अच्छा है, उसे कितना ये है ना, ये अगर किया ना तो ऐसे फील करो, पता नहीं ये फील करो, वैसे तो बहुत अच्छा पता चलता है, फील करो ना तब पता कितना वैसे 3% ना ऐसे करो। अगर आ गया वेल इनपुट बहुत बढ़िया है, देखो हाँ अगर तुम्हारा तो दिख रहा है बढ़िया है, अगर जिसका नहीं दिख रहा है स्किन थोड़ा डार्क मार्क है तो हाँ बस 20 ये तो बहुत अच्छा है, ये तो बहुत इजी इलेक्ट्रिक कर दिया ना, लीटर है ना, ये इलेक्ट्रिक कर दिया ना।
कंट्रोल तो सब
तो आना चाहिए।
ये 2.5 यूरो
सिक्स हो गया ना, छः ज्यादा आता कोई तो ये और आप एक जैसा थोड़ी वही आपका भी छः हो गया।
सर जो ग्रेडिंग करने में सही है ना 1+2 के उसके हिसाब से मॉडिफाई
फिर इसके बाद हाँ ऐसा करके इसको खींच के ये कहीं बुक में नहीं लिखा है, ये यही इन्वेंट हुआ है ना, ये कोई गाइडलाइन में नहीं लिखा है कि ऐसे करो करके। दूसरा से हुआ है ना, हाँ ये मैजिक टेप वगैरह पोटेंशियल का इन्वेंटेशन। हाँ मतलब नहीं भी कर सकते हो, मतलब ये कोई अगर पंगेबाज कोई इंसान है तो कर लो, एक दिन बाद में तुमको सामना करे। आप मतलब ये बोल सकते हैं ना, कोई इम्प्रूव नहीं आया कि मेरे को गलत इम्यूनोथेरेपी दे दिया, ये लो भाई कहाँ गलत है तेरे रिपोर्ट में है ना। तो वो अभी रिसर्च इस पे ये हो रहा है कि इसको हम AI बना रहा है यूरोपियन वाले। अभी अब तो आप लोग वो है ना न्यू कमर, यूरोपियन में क्या करना है, इसको वो अल्ट्रासोनिकली के लिए मेजर करके उसको कंप्यूटर से प्रिंट होके फोटो और ये दोनों आ रहा है। अभी मैं FI गया था तो स्कॉटलैंड में कोई कंपनी वाला ऐसे भी देखा रहा था, मैं भी 3, 4, 5 साल बाद ऐसा भी आ जाए।
ऐसे देखना कि माइक्रोस्कोप
वही जैसे बोला था ना, ऐसे स्टडीज हुआ है। वो अभी रिसर्च है सर, कोई रिकमेंडेड नहीं है, आपको नया रिसर्च चीजें बता रहा अभी तक
Everybody has experienced how the prick test can be done. There should not be any problem, and you can explain to the patient also there is nothing to worry basically. Otherwise, sometimes the patient feels so many injections has to be given, so they are afraid. So that's what my main aim, that you can experience yourself how it can be done. Now coming to the taking the reading of the test and everything. So I think reading also I have explained you how to do it, so nothing, I don't have to explain. Only you need to see, ideally it should be erythema and wheal, but all the guidelines recommends wheal because the erythema is sometimes you are not able to see basically about, and in the Indian condition more so basically this is applicable. So wheal size. So wheal size you have to see the maximum diameter, capital D by small d divided by 2 is equal to this. Then the reading is anything which is more than equal to 3 mm size of the negative control is positive. For your practical, if you want to give only positive and the negative. Okay? Then after that, you sit down again with the patient. Again, that's why I have divided into 3 groups. One is the history taking. Everything is correlating with your positivity or not. If it is not, then it is not clinically significant allergen for you. The one part is finished. The third part is, then third part again divides into 2 parts. Now you want to start the immunotherapy, then how to order to the manufacturer about the antigens to which you want to give the immunotherapy. Simple theory is whichever the antigens correlating with the history, they are clinically significant for you. Choose those allergens for the immunotherapy for that particular patient. Explain the patient that whenever you start the immunotherapy, then there may be some increase of the symptoms initial phase because of these reasons, or you know the reasons, you can explain. So nothing to worry, you can increase your dose, there is no problem of the medication. And then you start the immunotherapy. If it is a single allergen, nothing to worry, you can start with. If it is 2 or 3 allergens, then you need to mix. How to mix and everything, that is also important. If they are homologous antigens, that will be talked to today. Then you can mix, otherwise not. To start with, please do not give immunotherapy against the fungus. Negative rule. The maximum result of the immunotherapy is with the house dust mite, followed by pollens, then the insects. Okay? So the immunotherapy, you can start it. The second part of the immunotherapy, one is the giving the order, mixing it, and then starting the immunotherapy. That again I am repeating it, whatever I have told you in the beginning. The basic concept of the immunotherapy is to desensitize, so that whenever they come in the contact of that particular agent, they are not having any problem. So slowly you need to increase the concentration of the antigen. Slowly you can increase the amount of the antigen, and slowly increase the duration of the antigen. Which this last chart has been made how to give the antigen. If you blindly follow this, perfectly fine. If you want to change somewhere or the other, you can change it, but the thumb rule is the same basically. Desensitization thumb rule is the same. So this is the part of the immunotherapy. Okay. Now, if any questions is coming, whatever we have discussed till now, any question which is coming in your mind, then you can just ask me so that I answer or elaborate whatever I have told. Because too many things, if I start taking the whole confusion will come.
Any false positive or any false positive, like anything like false positive, false negative in this?
False positive, yeah. The false positive and false negative may be there. So that's why history is very important. That's why the correlation with the history is there. So on an average, yeah, intradermal also will show you, demonstrate you how the intradermal is given. That's all. I don't want everybody should do it. So there are two types of the skin testing is there. One is the skin prick test, another is the intradermal test. There is a false negativity with the prick method, and the false negativity is more with the prick method, and false positivity is more with the intradermal method. Okay? False negativity means it looks like the patient is allergic to that particular, but the test is coming negative. So you need to be doubly sure. You can repeat the antigen with prick method. If again something is there that the patient is 100% sure that no, I have a problem with this. So you can even test it with the intradermal also. So there is no problem doing with the intradermal also to know whether the patient is positive or negative. So that's the meaning.
So, what will be the ideal time gap between two tests when we are actually doubting that these are falsely
Next day you can do next day.
24 hours.
Or you can do it same day also if the space is there is no problem.
On a different site. Yeah.
We do basically next day. Ours is slightly away, so that picture I am not putting it at your place basically. So that's about the test. So anything if you want to ask about the history taking, preparation of the antigen, giving the antigen, interpretation of the antigen, starting the immunotherapy with a simple 1 or 2 antigen, single antigen. Initial phase you start with the single antigen, which is 1 antigen, which is most appropriate you can start. So the confusion.
Can you explain the interpretation part once again?
What interpretation part?
Sir, like you told in the lecture that we take readings from the, if 3 mm is, if the value is more than 3 mm of the negative control. So these are the readings. Sir, whether it is buffer saline or histamine control.
Again, please ask, there is no problem. So the test has to be evaluated with the buffer saline. Anything, if it is more than equal to of the buffer saline in bracket negative control is taken as a positive. What the point? Again I am repeating in another way. If suppose buffer saline is 0, then whatever I have told you is correct. More than or equal to 3. If suppose the buffer saline is 1, then automatically it will go 4. If it is 2, it will go 5. Got it? Next question. क्या है? That's all. Yes. Okay.
Sir, जो house dust mites होते हैं, they are also usually 2 are positive. So
2 are
both
positive means?
D Farini and the DP.
Yeah.
Both can be given together. They are considered as 1 or 2.
They can be given together. There is no problem. Nowadays, if you go for the skit, all the companies are giving the mixture of all.
All dust mites.
All dust mites. So one antigen they will give house dust mite. They do not segregate it.
Sir, in the morning, Dr. Achal Gulati told there is epilymphatic and epicutaneous also method is. Sir, वो सब theoretical है या?
नहीं, मैंने अभी वो रिसर्च पे है अभी, है ना? इंट्रा लिम्फेटिक है, उसके बारे में हमारा एडवांसेस इन इम्यूनोथेरेपी में आएगा, है ना? इंट्रा लिम्फेटिक में लिम्फ नोड में इन्वाइनल लिम्फ नोड में हम एंटीजन डाल देते हैं, 2 शॉट देते हैं, दैट्स ऑल बेसिकली. So these are in the research process. All are in the research process, which will be dealt. Don't worry. Which will be there is advances in the immunotherapy. One lecture is there, so that will be covered. No worry.
So, if a patient is undergoing therapy for any collagen vascular disease, he is taking disease modifying drugs. So, for that patient, can we initiate?
Ideally, should not be given in those cases. So that's what I am telling you always. It's not like that each and every patient who comes to you, then you start the immunotherapy. No. We should, selection of the patient is very, very important. Correct. Younger are the patient, better the result. Minimum are the antigen, better the result. सिंगल एंटीजन बेस्ट रिजल्ट, डबल कम हो जाता है, ट्रिपल कम हो जाता है, 3 से ज़्यादा लेना नहीं. But I can expand it.
Yes.
There are two school of thoughts are there. One school of thoughts is European school of thoughts. Then एक एडवांस कोर्स करेंगे ना तो फिर हम लोग डिटेल में जाएंगे. अभी प्रीलिमिनरी में ऐसा जस्ट ट्राइंग टू स्टॉप माई सेल्फ. सो टू यूरोपियन स्कूल ऑफ थॉट्स, अमेरिकन स्कूल ऑफ थॉट्स. यूरोपियन स्कूल ऑफ थॉट्स और ये कहेंगे मैक्सिमम 2 तक दे के खत्म करेंगे, है ना. Monotherapy, monosensitization, monotherapy. The American school of thoughts is, if the patient is polysensitive, sensitive word I am choosing,
Yeah.
sensitive, polyallergy, polytherapy. वो 7-8 को mix करके दे देते हैं. So, basically, so literatures, all the literatures of the consensus statements are there based on single elements. So you will find all the literature whenever they are giving the reference, maximum literature is for the house dust mite, then few pollens. उसमें भी एक pollen होगा, 2 pollen होगा, not all pollens. Very less researches are on this.
Means maximum 3 we can give together, sir.
Max, आप single के लिए पहले सोचिए.
ठीक है.
Choose the best one which is the single. आप अपनी practice you should start with the single one. छोड़ दो बाकी को मत. Then you get a knowledge and everything. Then you start and then you do. So I think that will be the best thing to start with. ठीक है अभी मेरा जो second objective है वो आज अभी पूरा होगा. Next batch का कल पूरा होगा. ये second objective है. Everybody should know how to do the allergy testing. So at least if you go back, you can start with the allergy test. And that knowledge.
तो एक ही वाइल में हाउस डस्ट माइट और पोलन करते थे कि अलग अलग वाइल करते
ये थोड़ी सी कंट्रोवर्सी है हाउस डस्ट माइट और पॉलन का. अगर आप अलग अलग रखें तो ज़्यादा अच्छा है. जो होमोलोगस एक्चुअली फंगस, इंसेक्ट्स एंड हाउस डस्ट माइट, somebody says yes, somebody says no. इसको मिक्स नहीं, किसी से नहीं करना चाहिए. My advice will be don't start any immunotherapy with the fungus. I have not given any immunotherapy with the fungus till now. And then if insects also should be separate, because today there will be lecture. There is a proteases are there which are secreted and which harms the other antigen in the mixing.
हैं. पोलन भी सकती 2-3
Pollen, 2-3 pollen ना mix कर दो कोई नहीं होगा. I think that will be the best straightforward answer.
मतलब पॉलन में पॉलन मिक्स कर सकते हैं, हाउस डस्ट माइट में हाउस डस्ट माइट मिक्स कर सकते हैं, पर आपस में नहीं मिक्स कर सकते.
हाउस डस्ट माइट को कई लोग मिक्स करते हैं, कई लोग नहीं मिक्स करते हैं. तो मैं एडवाइस करूंगा अलग रखो, ज़्यादा अच्छा रहेगा.
आपस में भी मिक्स नहीं करना.
नहीं, आपस में हाउस डस्ट माइट अगर दोनों है तो दोनों को मिक्स कर दो, कोई फर्क नहीं पड़ता. हाँ, आप एक भी अगर कर लोगे तो क्रॉस रिएक्टिविटी उसकी आ जाएगी, आपका काम हो जाएगा. दोनों दे सकते हैं, दोनों का वायल अलग अलग करके दे सकते हैं. यू स्टार्ट विथ 1, 2 एंटीजन मैक्सिमम आप लोग करो, 3, 4, 5 पे मत जाओ. So any question?
Sir,
So we have-
sir, you test for 68 allergens.
Yes.
So you do in the same setting, sir.
Yes.
Yeah.
Yes.
Tomorrow,
The same
day
format.
after tomorrow you will see.
In the
The
same
both-
format.
arms.
Both arms. Both arms and the forearms. It is being done. So tomorrow you are going to
Day after tomorrow.
Day after tomorrow. So
Day
day
after
after tomorrow you will see.
tomorrow.
Hindu will be doing it fast, and you will see there.
So if a patient has dust allergy 2+ and cockroach allergy 1+, it is better to start immunotherapy with only dust?
Not dust.
Dust
mite.
Dust mite. Only dust mite.
It is better to start with that. आपका काम, उसका भी काम हो जाएगा, क्रॉस एक्टिविटी है, उसका भी काम हो जाएगा.
डस्ट माइट की स्टार्ट करेंगे तो कॉकरोच वाले पे भी इफेक्ट
और वो आ जाएगा क्रॉस एक्टिविटी. So that's why you have to choose the right patient, right antigen. Results are very good. So choosing of the right patient is very, very important. And right antigen, two things. The results are good. For the ENT people, best is if you compare between rhinitis and the bronchial asthma, the best result is in the rhinitis. Another statement I am doing. How many percentage of the patients of the rhinitis lands up with the bronchial asthma?
Sir, quite a lot of.
Quite a lot, 60 to 70 to 80%. है ना? But the literature shows you can prevent development of the asthma if you treat the patient of the rhinitis with immunotherapy. I wish somebody will show you. I'll see today how they are there. Otherwise tomorrow maybe I will take a class of the immunotherapy also. So a lot of literature are there. You can prevent the development of asthma by treating the rhinitis. हम लोग rhinitis को we take it as बड़ी simple common cold हो रहा है, छींक हो रही है, कोई problem नहीं है.
नहीं सर, ENT वालों में बहुत आते हैं, ENT वालों
फिर
में
आपके पास लेट ही आते हैं. पहले तो सोचते हैं कि कॉमन चीजें हैं, ऐसे ही है, ऐसी ही है, ऐसी ही है. जब वो परेशान हो जाते हैं ना तब आते हैं, वरना नहीं आते हैं, है ना? Am I right? So this we feel is a common phenomena हो जाता है. हिस्ट्री इफ यू स्टार्ट ब्रोंकियल अस्थमा की हिस्ट्री यू स्टार्ट अभी तो सांस कल से अभी 1 महीने से शुरू हो गया, और उससे पहले कोई प्रॉब्लम थी नाक की कोई नहीं. फिर वो रेसिडेंट के पास से जब हमारे पास आएगा तो पूछेंगे कि अच्छा कभी चेंज ऑफ सीजन में स्नीजिंग वगैरह, वो जो नॉर्मल सबको होता है वो मेरे को हो जाती है, उसके लिए तो नॉर्मल है. अच्छा नॉर्मल में कैसे होता है? फिर आप जाओ तो पता चला कि द पेशेंट है फ्रॉम द चाइल्डहुड देयर इज ए सीजनल राइनाइटिस इज देयर व्हिच वी जस्ट फॉरगेट इट. एंड व्हेन द नाउ द राइनाइट वो तो ठीक होना शुरू हो गया सर, फेनोमेना है. राइनाइटिस ठीक होना शुरू हो गया, सांस की शुरू हो गई, तो फिर परेशानी हो गई. आप समझ रहे हैं? सो वी जनरली ट्रीट दिस राइनाइटिस एज ए कॉमन थिंग, कॉमन कोल्ड है. बट दैट कॉमन कोल्ड अल्टीमेटली 70 to 80% people land up with it. You can prevent there. That's the beauty of the rhinitis patient, ENT people. ENT people can do the wonders if they land up in this treatment. तो आपकी पल्मोनलिस्ट को प्रॉब्लम हो जाएगी. तो
जैसे एलर्जिक राइनाइटिस सीजनल है और मॉन्टेगल से खाने से 2 महीने खाता ठीक रहता है, पर एक बार सर्दी में होता है, उसमें भी इम्यूनोथेरेपी देना
करना चाहिए.
हर साल होता है, पर देना पड़ता है 2 महीने 3 महीने.
ये अच्छा है ना. दिस इज आइडियल कैंडिडेट फॉर यू. बेसिकली फाइंड आउट द एलर्जन, यू ट्रीट दिस. अदरवाइज व्हाट मॉन्टेगल इज नॉट गोइंग टू टेक केयर. अल्टीमेटली जब खाएगा ठीक रहेगा, फिर अल्टीमेटली द पेशेंट आफ्टर 15 years द पेशेंट विल हैव द lower airway disease. So it's better to put it like this. अभी हम लोग कर लें?
Yes, sir.
So what we'll do, we divide into 3. तीनों जगह किसी को रख दे. हाँ फटाफट prepare करो. You can keep asking the questions. There is no problem.
So immunotherapy can also be used for food allergy.
Food allergy का टॉपिक हम करेंगे. I am going to take the class on that. Food allergy. I am passionate about the food allergy. Yes, earlier it was not. Till last year, I used to tell no immunotherapy against food allergy, but now I tell yes. I had given immunotherapy, I think around 2000 when I started my passion work in food allergy. So at that time, as a research purpose, I took the permission and I started. That was good. But till last year, the consensus statement were not for immunotherapy, but now they are there for the immunotherapy only for the
Yes, sir. I'm ready.
3 foods, है ना? Milk, egg, what do you call them?
Peanuts.
Peanut. Please consensus statement. So now what we'll do? So I think testing and everything you know, and some basic background of the immunotherapy you know, as you go on, then you will not learn. So we divide into 3 parts basically. So we will have exposure of how to do the pollen count, how to do a specific IgE, total IgE, just exposure. You cannot go on doing it. And then how to FEN, how to interpret FEN or do FEN. So how many people are there?
19, 6, 6, 7 कर देते हैं.
So 6 people, first 6.
Come,
Sitting. They should go to room number, whatever he is guiding.
6 आ जाओ.
Lancets are there. If you go abroad, these are the kind of the lancets are there, so that they dip it into the antigen here, and at a time, 10 antigens can be injected. So, like these are the single ones. Plastic ones are abroad. Antigens are there. So I just wanted to show you about this. Then EpiPen I will show you tomorrow. So the different kinds of the antigens instruments, pricking methods are there. So I just wanted to show you. These are the pillows, covers are there. So anti-allergenic pillow covers are there in the market also. You can. So now you can just proceed. I just wanted to show you.
चलो आ जाओ.
ABPA panel, HP panel, just like you can see from it, these panels has been created with the help of this machine. So this machine is basically based on singleplex method. Okay, so there are two methods available in the market, singleplex and multiplex. The specific IG testing around 550 plus, whereas that components we can do on this machine, that is the FADIA, on that FADIA that is 100 plus. Okay. And this autoimmunity parameters is 50 plus parameters we can run on that. So that I have told you that the specific IG, total IG, tryptase you can run. Tryptase you can't run on the smaller machine. Okay, so a smaller machine is this one, which is placed in AIIMS Delhi. Okay, so this one.
Tryptase level करते क्यों हैं? And when how much time? Anaphylaxis के जो patient होते हैं उसके अंदर करना है, but it should be done within 2 to 3 hours after you had the episode, not later than that. So a patient comes to the OPD and says that I had an episode of swelling of mouth, breathing difficulty, wheezing, and it come after 2 days. Then there is no use of doing the tryptase levels. So it should be done within 2 to 3 hours, maximum 4 hours post the episode to confirm the diagnosis.
So the VAS, it has a VAS training of autoimmunity as well. We will provide you the hard copy. It's very tiny size. So these are the number of CRD you can run. So dust mite CRD you can run on that, and this egg, milk, peanuts, then Aspergillus fumigatus CRD you can run on that machine. Okay. So these are the licensed CRDs available in the market for India. You can run on that FADIA machine. So this is fully automatic random access machine. There no manual intervention is required. Once you have to just place the reagents, antigens, conjugates, and you have to just command the machine.
I'll just stop you for a moment. We're talking about CRD. So do you know what is CRD actually? It's component resolved diagnostics. So what actually it helps in, it will help you to identify which part of the protein in this particular thing is causing allergy to you. So say if raw egg is causing allergy to you, you can boil it and then you can use it. So it helps in that way. So if you're eating, like you're having allergy to apple, so you can just peel and you have the allergy and finally you do a CRD and you find that yes, the protein which is in the peel of the apple is causing allergy to me. You can peel it off and you can eat. So it changes the whole of the domain of your treatment actually. So that is CRDs. So that is CRD. So that is clear I think for you.
Adding to you in that earlier what was happening when we are planning the immunotherapy for the patient, with some patients for responding, some patients for not responding. So it will also help to characterize that which patient is actually going to respond to the immunotherapy. So just like for example that dust mite immunotherapy. So the patient who will come sensitized to DERPI1, DERPI2 would be a good class of audience who would respond to immunotherapy. So machine-wise, I was telling you like that it's a fully automatic random access machine. It means that if you are running the machine, meanwhile you get some sample, you can add some. Okay, and if you run around 8 to 10 hours of machine, so the output of the machine would be around 350 number of antigens. Okay, right. So we are talking in terms of antigens, not in samples. Okay, I mean one sample can contain 10, 15 as per the need number of antigens. So the best part is with the machine is that the common reagents can be utilized as well as in autoimmunity as well as in allergy. So it provides an economic solution to us. Okay, the calibration is also valid for the 28 days. You don't have to calibrate day by day. So now the questions comes, why ImmunoCap? Okay, because in the market there are some other methodologies available who offer the same kind of solution. So why we should choose for the ImmunoCap? So ImmunoCap has been proven record from last more than 50 years. Okay, and from that perspective, it is giving you a gold standard results in vitro testing. Okay, and the methodology wise is very simple. So we have pen with us. It's a reaction vessel. Okay. Yeah. So antigens are basically placed in the cap. Okay, and if patient is having the antibodies, it will get bind to those antigen antibody reaction will happen. We will place the conjugate or the secondary antibody labeled with so this is pen. So we have a separate pen for separate allergens. Okay, so if you see, if you open it, there is a cap. Okay, at the bottom of this cap there is 3D polymer matrix, which basically increase the surface area, so we can place more number of antigens. Okay, so how it will help? When the patient serum will be added and patient must be having antibody, in that case this antigen antibody reaction will be provide high binding capacity, and ultimately it will give you the higher number of emission of fluorescence. Okay, so in that case it will ultimately increase the sensitivity, specificity of the test. So as sir told you initially that it's having up to 90% of sensitivity and specificity. Okay, so that makes it, that is the USP, and it's make it class apart test if you compare with the other conventional methods. But I told you that is machine. This is the comparison of higher binding capacity if you compare with a simple passive coating. I mean that you have placed some antigens at the surface of any tube. So if you are considering it 1, so it will give you 150 times more binding capacity, and ultimately it will reflect in sensitivity, specificity. There are various publications on that who advocate that single plex method should be used, that VIA method should be used for the diagnosis. This is the outcome of the machine. So this is the dummy report of a patient, where you can see that patient has sensitization in the first case with insect, food and this wheat. So it shows you the only sensitization, as sir told you, and it doesn't mean that patient is having allergic to those antigens. So that is your expertise, that you will take the history of the patient and you will say that whether the patient has been actually exposed to them, those allergens or not. Okay, if they are not exposed and it report is telling that it's a positive, it doesn't mean it's sensitized to that those allergens. Why that? Because it could be because of some cross-reactive protein. Okay. So the one more point I would like to add is that the value comes in KUA per liter, that is a kilo unit allergen per liter. So how this machine is offering the solutions? The first is screening, then we have a panels, and then disease specific panel. So screening is basically that you don't have, the machine will not tell you exactly which allergen is causing the allergy or the sensitization. I mean, it will just screen that whether the patient is actually having IgE mediated allergy or not. Okay, so we have Phardiatop test available with us, which is a blend of most common allergens, which tells you that whether actually the patient is having IgE mediated allergy or not. Right. The second is the panel. So in panel we have symptom based panel for the ease. If the patient is having skin related panel, rhinitis or asthma, so we can opt the panel accordingly. So panel has been pre-designed in a way that the allergens which are causing eczema has been included in that, like for same for the asthma and rhinitis. The second option is available is the comprehensive panel. Then the flexi panel. Flexi panel is as it will help you when you take the history. The patient will tell that okay, I am having problem when I am eating this kind of food or something. So in that case, we have options to create a flexi panel. Any 5, any 10, as per the requirement you can choose. Then the disease specific panels. That food panels are available. Veg, non-veg panel. We can do that. Then it's disease specific panel like HP and ABP available for it. I have to share you that Aspergillus fumigatus IgG and IgE along with the total IG for the diagnosis, and for the screening is Aspergillus IgE with total IG, that will help for the screening. And then in HP we have around 13 modes are available, that will give you the value of a specific IgG. Right. That is the specificity of that panel for a specific IgG. So the literature is with you, I am not going into that. And now the last part is that autoimmunity. I told you that why you choose Immunocap. What is the USP? Now we will talk about that autoimmunity parameter, because autoimmunity market already there are a lot of solutions available for the autoimmunity. So what is the differentiator here for us, that we are producing antigen with the help of this baculovirus system. Okay. So the most of market they are using traditionally E. coli system to produce the antigen. So how it's making the difference? It's giving you the best quality antigens. There is no batch to batch variation. Why? Because we are producing antigens with the baculovirus system, right? So these are some important panels available for the autoimmunity. It can be utilized in myositis and vasculitis. Okay, so there are a lot of parameters available with us. So now I would like to request you, if there is question, I can try to answer.
In first few slides, I have seen the tryptase and two more investigation that.
Eosinophilic cationic. This one. This one.
ECP.
That is eosinophil cationic protein. Okay, that you can also run on this. And that IgG class 4 you can also do when you are giving any patient to immunotherapy and you want to see that how the patient is responding.
And
so you can monitor it with the help of
specific IgE, all variable available.
Yes, so we have a vast list available
Quite a good
for
list, but
specific
not
IgE.
all for Indians. But yes, the European.
So the challenge may become in case if you are looking at particular pollen. Otherwise, all the allergens you will be able to get it.
See, it is not to be done in all the patients in first group. First of all, better is you take a detailed history. After the history, when the history has been done nicely, you can either go for the skin prick test. But in certain conditions, like a patient is having eczema, dermographism, or in which SPT is not positive, and you have still very high doubt that yes, this is the thing that might be causing, then you can move over these tests, because this is quite expensive to run in private centers. That is important thing. Okay, and to confirm your diagnosis, then you can do. Okay, so by the means with whatever I would say, the best is history, skin prick test, confirm your diagnosis with Phadia. Any confusion is there, confirm it with Phadia, and then that is the thing how to move forward. That lies in
और भी है कोई सर एक और है As you know, I am Dr. Manoj Kumar. We have a pollen count department which is Mr. Lewis. He is doing all pollen count preparations, live preparation and counting. Okay. We have a pollen count sport trap system. This is Bukhar from Bukhar, USA. We are using two type of pollen count stations. Instruments. One is 24-hour and other one is 27 days. So 7 days recording system. In 1 day and 7 days recording. In 1 day 24 आवर के लिए इसमें बेसिकली कैसे ये सारा खराब हो रहा है
ये फुल हो गई सर, हमने अभी डेमो दिया।
ये चाबी से इसे एक क्लॉक एंटी क्लॉकवाइज, जैसे हम नॉर्मली अलार्म को फिक्स करते हैं, पुराना ओल्ड होता था ना, इसमें एक क्लॉक सिस्टम होता है। 24 आवर उसे कंटिन्यूस चला के रखता है टाइम के अकॉर्डिंग। वेल एयर इसमें देखिए इनलेट है, एटमॉस्फेयर से जो एयर है वो सक करता है एट द रेट ऑफ 10 मिलीलीटर पर मिनट, और वो सीधा जाके इस स्लाइड पे हिट करता है। जैसे जैसे टाइम के अकॉर्डिंग रोटेट करता है ये ऊपर जाता रहता है। आफ्टर 20 days 24 hour वन डे इस स्लाइड को रिमूव करके देन एक स्लाइड प्रॉपर किया जाता है, बनाया जाता है, फ्यूसिडिन के साथ डाई किया जाता है, एक स्लाइड प्रिपेयर किया जाता है एंड देन माइक्रोस्कोप में रीड किया जाता है कि कितना पॉलन पूरा होल डे में कलेक्ट हुआ है। इवन एयर में जो भी पार्टिकल्स होंगे पॉलन के साथ साथ स्पोर्स, फंगल स्पोर्स भी हो सकते हैं और डस्ट पार्टिकल होते हैं, सब इसमें ट्रैप हो जाता है। 7 days के लिए किया जाता है। 7 days में बेसिकली ये राउंड एक टेप लगाया जाता है जो उसके ऊपर एक जेली क्या लगाते हैं, पेट्रोलियम जेली लगाते हैं। जो भी स्पोर इस पे हिट करेगा एयर के थ्रू सक करेगा, इस पे चिपक जाएगा और चिपकने के बाद ओवरऑल 7 days ये कंटिन्यूस चलता रहेगा। आफ्टर 7 days इसे टेप को निकालेंगे और एक स्लाइड प्रिपेयर करेंगे 7 days की, है ना। 7 days की स्लाइड प्रिपेयर करने के बाद ये इस तरह से दिखता है टेप, आप देखिए। आफ्टर आफ्टर 7 days ये देखिए, सिंपली आप इसमें डस्ट पार्टिकल भी देख रहे हैं और टोटली कलर चेंज हो गया। अब इस पे ये एक स्केल है, इसके अकॉर्डिंग इसका स्लाइड प्रिपेयर करता है 7 days, ये 7 slides। फिर इसको एक प्रोसेस किया जाता है, प्रोसेस करने के बाद 7 slides बनेगा, उसके माइक्रोस्कोप के अंदर हाँ पॉलन काउंट जो भी दिखता है उसे रिकॉर्ड किया जाता है। एवरी डे पॉलन काउंट इंस्टीट्यूट फ्रॉम सिंस 2013 आउटसाइड गेट नंबर 1 एंड गेट नंबर 4 पे डिस्प्ले होता है, हाँ कि कितना पॉलन काउंट है। डिस्प्ले आफ्टर सर के बाद, डॉक्टर राजकुमार के बाद, डॉक्टर सर ने डिजिटली पॉलन काउंट फॉर पेशेंट और इवन फॉर रिसर्चर्स और एनीवन, उनके लिए डिस्प्ले किया जाता है, उससे इंफॉर्मेशन मिले और पेशेंट को रिलीफ मिले। और उससे डे टू डे अवेयर रहते हैं, इवन डॉक्टर्स भी आज पॉलन काउंट कितना है, तो उसी तरह से ट्रीटमेंट और ये सब चीज़।
सर ये जो पार्ट है
यस, मैं एक बार डेमोन्स्ट्रेट करके बताओ कैसे लगाते हो आप।
सर ये हमारा 24 आवर क्लॉथ है, जिससे कि उस पर फंगल स्पोर वगैरह कुछ पहले से ना रहे।
कोई नहीं, ऐसे ही लगा दो, ट्रायल करके इसे
इसको हमने स्टेलाइज किया पहले, उसके बाद पेट्रोलियम जेली फिक्स की इसके ऊपर, ब्रश इस पर हमें एक लेयर बनाएंगे।
आइए आइए आइए
फिक्स करने के बाद हम इसमें 24 आवर के लिए इसको फिक्स कर देंगे।
इस पे फिक्स कर देंगे,
उसके बाद हम इसको ट्रैप में स्टॉक कर देंगे 24 आवर।
इसका स्लाइड का जो फेस है उसी एयर उस पे है, जो सीधा एयर है वो वर्क करेगा एट द रेट ऑफ 10 मिलीलीटर पर मिनट के अकॉर्डिंग।
एनेबल पर से स्पीड से जो है एयर एंटर करेगी स्लिट से एंड देन इट हिट्स द स्लाइड एंड व्हाटएवर देयर इज इन द एयर, बिकॉज़ द स्लाइड इज ग्रीसी सो इट विल इंटरप्ट द पार्टिकल्स।
जो विंड की स्पीड होगी, आप देखिए वो विंड की स्पीड होगी उसी के अकॉर्डिंग ये उसी विंड पे
मूव करेगा। Windshield है, that is the windshield that helps it to move, that is the rain shield that protects it from if it starts raining. This thing has to be placed at the highest point whatever is available. At our place it is the 7th floor terrace where we keep it.
पावर से ऑपरेट होता है अंदर।
यस यस यस।
So once we are done with this all this, then it is differentiated. Now every pollen has a different morphology, so it is a science in itself that is called aerobiology, to identify which pollen belongs to which species of tree or grass or weed, and accordingly the species of these different type of plants. So they can be differentiated under the microscope. However, we do not at present have a very good expertise to do so, but however, he's doing it to some extent because he's trained in that very discipline. So he'll show you how it looks under the microscope. What have you focused?
Yes, ma'am. Grass.
So some
Cyanodon.
Cyanodon grass pollen, you can see it looks like that. It is there on the microscope and is being displayed on the screen. So this way you can see how many of them. इस पे भी देख सकते हो, सामने स्क्रीन पे भी डिस्प्ले.
कोई जो pollen है वही colored होगा, stained होगा.
So accordingly we'll calculate per cubic millimeter कितने हैं, and that is the pollen count that will be displayed at a gate number 1, giving you the exact pollen count for the previous day. This is more of a research thing, and that is how it works over here, but this is something that is very important from the public point of view. This is a public health concern. So it works when you are managing community, not for a particular patient. However, now you have samplers that work at individual level also. The same company that you have seen, that is the Burkhardt air sampler, this is a community kind of a thing, but you have personal air samplers as well that can be given to the patients and will be kept in the patient home for around 24 hours, and then the slide can be examined and we can see what kind of allergens this particular patient is exposed to. So that is what we call precision or personal lab samples, but you can keep one and you can give it to the patient and then the patient can return. But then you need the expertise to examine what is at the slide. Soon will have AI developed in certain fields that it will give you everything calculated, this pollen seed, and then you just have to react to that how it is to be managed. Okay. Any questions? Done?
Yes.
Thank you.
Is just about being highlighted. We are working on it. Soon we'll have all the things in place, and it is particularly important. इतने 40% लोग एलर्जिक हैं, हम हेल्थ वार्निंग्स तो दे ही सकते हैं, समथिंग एटलीस्ट दैट वी कैन प्रिवेंट. बहुत सारे लोग बोलते हैं दे आर नॉट इनटू अवॉइडेंस, बट आई डेफिनेटली से दैट अवॉइडेंस वर्क्स. एटलीस्ट आप खत्म तो नहीं कर सकते हो, यू कैन मिनिमाइज द एक्सपोजर. सो यू शुड ऑलवेज वर्क ऑन इट. अगेन इवन इन द प्रिस्क्रिप्शन ऑफ द इम्यूनोथेरेपी काउंसलिंग वर्क्स. Here also, at least we need to educate our patient that something like this exists. Only then they'll know. Or else हमें खुद को ही नहीं पता तो उनको ही क्या पता. And I do not blame everybody क्योंकि हमें भी नहीं पता है. Until unless मतलब spread नहीं होगा ना knowledge, तो किसी को भी नहीं पता होता है. At least now you know, you can ask them कि ठीक है. वैसे तो अगर देखोगे तो pollen counts अभी online आपको मिल जाते हैं. Satellite data तो अभी भी है. It is not like that कि satellite data नहीं.
को हम फिनो बोलते हैं, ठीक है. तो अगर आप सिंपल फिनो भी गूगल पे लिख दे या पॉपमेट लिख दे, हजारों के पब्लिकेशन आएंगे. फिनो यूज दिस, फिनो यूज वो, फिनो यूज. लेकिन अभी तक कोई भी गाइडलाइन, कोई भी सोसाइटी, किसी ने फिनो को रिकमेंडेशन नहीं किया करने के लिए, ठीक है. नंबर 1. नंबर 2, फिनो जो है वो हम एक्सेल ब्रेथ में, हमारे ब्रेथ में नाइट्रिक ऑक्साइड की कंसंट्रेशन मेजर करते हैं कि इससे क्या हम कर सकते हैं. तो वी यूज दिस इज ए डायग्नोस्टिक और प्रोग्नोस्टिक मार्कर फॉर मैनेजमेंट ऑफ. हाँ जी बताओ.
फिनो ही चल रहा है.
हमारा हो गया भाई, हमारा लास्ट ग्रुप है. तुम्हारे पास उधर वो वाले आना है, ग्रुप 1 वाले आना है. ठीक है. तो फ्रिक्शन हाउ फिनो can we use the फिनो for diagnosis of asthma, allergic rhinitis या कोई भी एलर्जिक डिजीज के लिए. इसके लिए अभी रिसर्च दुनिया भर में चलते रहा है. फिनो नंबर 1 is to identify can we use this for a diagnosis of asthma or rhinitis. No, इसका स्ट्रेट आंसर है अभी तक नहीं है ना, नहीं यूज नहीं कर सकते हैं. लेकिन फिनो खुद पे इतना रिसर्च हो चुका है. देयर इज ए गाइडलाइन फ्रॉम अमेरिकन थोरेसिक सोसाइटी व्हाट इज यूजेस इन what are the uses of pheno? 8 point. अभी हमारे पास what are the uses of pheno? This can be used for whether your inflammation is eosinophilic or non-eosinophilic. जो अस्थमा है तेरा अस्थमा का phenotype नहीं वो eosinophilic नहीं उनको दे देना तो क्या हम इसको eosinophilic inflammation है कि नहीं नंबर 1 uses number 2 step up and step down of therapy pharmacotherapy.
Here it is kept over here. So ideally this thing is to be kept at the highest point that whatever is available at your place or our place we have kept it at the terrace of the 7th floor. So there we have kept it. This is just for the display purpose that we have kept it inside. We will also visit the 7th floor one. Okay, what this thing does is that it is kept in the open and it has a slit, it has a windshield, it has a rain shield, then you have a lock system from where you can slide or the rotating this device. So it hits the slide and whatever there is in the air that gets trapped on the slide because the slide is being for continuously for 1 week, 7 days. And once the sample is collected, it is put here in this form and then this every area will represent 20 grams. And then we can have the count graph.
First, we have a stand, right? Still I feel 70% ethanol. And install into the drum for 21 hours, 24 hours.
रेनी सीजन में तो ये
Rainy season में otherwise also the particles in the air less हो जाते हैं, but it is not that, it is not zero. Your pollen count will come down accordingly. There are certain pollens who are prevalent in the rainy season, but definitely the pollen count comes down. So this is how then it starts moving. The slide will, जैसे if the slide is placed just in front of this particular family, and this is a science in itself that is called aerobiology. So people work in this field also. So there, though we are able to identify pollens to some extent, but not particularly how. 7 days के लिए टेप लगा देंगे ये तो इसके लिए राउंडेड
मैम यहाँ से फाइन कर सकते
पूरा चला जाएगा और वो धीरे धीरे इसके लिए इसका स्टार्टिंग पॉइंट
जी मैम सिम का आर्टिकल
इस फॉर्म में सेलेक्ट
घास
जो भी है सारा सैंपल जो कि हमें ये हर 24 आवर्स के लिए
7 days
1 2 4 5 6 But अगर अभी ऐसे सोचो कि different pollen stations, so India is very poor in having the distribution of pollen stations. The largest pollen station network is in Italy and pollen stations all throughout the world. And you have to click on which station you want to go. So if you have a look at the India, so there will be I think 3 or 4 stations. One of them is there. North Delhi only one station. This is there. And it is registered under the name of Dr. A.B. Singh, whom you met yesterday.
लेकिन दोनों मरकर का सेकंड ड्रॉबैक ये है कि इंडियन नॉर्मल पॉपुलेशन का वैल्यू तुमको पता ही नहीं है आप कैसे करोगे एक्सपेरिमेंटरी वेदर इट इज द टोटल आईजी और वेदर इट इज दिस एफईडो उसका
allergens I need to check. So this is the beauty of that single plex platform that it offers you the customization. Okay, where some and the last one is this disease specific panel, ABP panel and HP panel. So capturing the antigens with the help of baculovirus method. So how it is going to add the value? It is telling, it's offering you the best.
हाँ ये सब कुछ चीज़ें हैं जो सिग्नल को लेकिन ऐसे एनिमल या तो रैबिट है I think we have to applicable for.
खुद पसंद की थी KG इन्होंने कि मैं यही चीज़ करूँगा राइडने का भाई तो बहुत डिफिकल्ट चीज़ है तो क्या एबल टू काम करना है
KGM से लखनऊ से क्या है
कुछ लेवल करो इस लाइब्रेरी
ये एम्बिगुअस है अनएबल हमारी कुछ लाइन सभी भारत और का ये मिस्टर श्याम मन डूबे हैं काउंसिल करते हैं आइए बेटा
तो मैं को ऑनलाइन
यस करने के लिए
हाँ हमारा जो टोल फ्री नंबर है सर वो तो वैसे हर एक प्रोडक्ट में अवेलेबल है तो जो हिंदी बट अभी हम लोग 17 लैंग्वेज में काउंसलिंग कॉल्स हमारे पास एक दिन में जो हमारे पास कॉल्स आते हैं वो लगभग 3:30 से 4 बजे कॉल्स 24/7 रहते हैं नहीं अभी मॉर्निंग 8 टू इवनिंग 8 और टोटल ऑनलाइन कॉल्स हमारे पास आते हैं स्टेट में कितने TCC एक्टिव हैं उनकी सबके नाम और उनके कॉन्टैक्ट नंबर तो हम हाँ तो उस केस में हम देते हैं कि जब हमारा बिहेवियर काउंसलिंग का इफेक्ट नहीं आ रहा है जैसे बहुत लंबे समय से वो यूज कर रहा है तो काउंसलिंग के साथ साथ वो चाहता है कि हमें कुछ NRT या नॉन NRT दी जाए तो हमारे यहाँ भी TCC सेंटर है तो अगर दिल्ली का है तो हम अपने यहाँ के लिए उसको रेफर करते हैं अगर किसी अदर स्टेट का है तो हम उसको उस स्टेट के नियरेस्ट TCC में
तो निकोटेक्स च्युइंग गम आते हैं यही है फार्माकोथेरेपी और कुछ भी
ये 2 तरीके का है तो ये NRT है निकोटीन रिप्लेसमेंट थेरेपी ठीक है दूसरा है नॉन निकोटीन रिप्लेसमेंट थेरेपी दो तरीके का है। तो ये मेडिकल प्रैक्टिशनर डिसाइड करते हैं कि आपको NRT पे शिफ्ट करना है या फिर हमें नॉन NRT देना है। नॉन NRT में कुछ साइकेट्रिक मेडिसिन होती हैं, जैसे सपोज आपने उसको क्विट किया, क्विट करने के बाद विड्रॉल सिम्टम्स हुआ, आपको एंजाइटी हुई, स्ट्रेस हुआ, तो स्ट्रेस मैनेजमेंट के लिए या फिर अगर आपको बहुत ज़्यादा मूड स्विंग्स हो रहे हैं तो उसको कंट्रोल करने के लिए,
सिम्टोमेटिक रिलीफ देने के लिए।
यस,
ये बेसिक काउंसलिंग
हमारा केवल काउंसलिंग है। हम एक कोई डेट सेट करते हैं और हम स्टेप मेथड फॉलो करते हैं। जैसे 10 सिगरेट आप पी रहे हो तो आज आप 10 पियो, कल से एक आपको कम करना। अगर आप सडनली स्टॉप करेंगे तो विड्रॉल सिम्टम्स इतना ज़्यादा होंगे कि फिर मैनेज नहीं कर पाएंगे। इसलिए हम लोग स्टेप मेथड फॉलो करते हैं कि एक करके।
सर आप रोज रेगुलर फॉलो
हाँ,
इधर सामने देख के थैंक यू सर।
हाँ,